Hi, my name is Nora, and I'm going to be doing my ostomy care validation video. Okay, let's get in my room. Pads to set my video on. Okay. Hi, Mr. Smith. My name is Nora, and I'm going to be your nurse today. How are you doing? Great, great. Well, what we're going to do now is change your ostomy bag. But what I'd like to do is walk you through the procedure because when you're discharged, you're going to have to do it at home on your own. So I just want you to be comfortable and know that you're able to do it. So while we're doing it, if you have any questions at all, just be sure to stop me and ask, okay? Do you have any questions before we get going? Are you in any pain at all? The ostomy bag and the area around it is not bothering you at all today? Great, okay, good to hear. Alrighty, so I'm just gonna get some gloves on, wash my hands, and get going. Alrighty. It's a beautiful day. Nice day to get out and get moving around. Alrighty, now the first thing I have to do is expose you a little bit. Of course, that's no fun, but I'm gonna get here. Okay. And the bag looks good. Can you see it? Move my table up so you can see me in the video. Okay. Alrighty. So, first thing I want to do is, do you mind if I just listen to your bowels before we get going? Thanks. Okay, great. Well, the first thing we're going to do is I want you to notice if you're having any irritation around your bag. If your skin's getting a little red or it's a little irritated, you're going to want to note that. We'll have to make some changes. Another thing, when you're changing your bag, you're going to want to make sure and empty it when it's a third to a half full, so it's not getting back up into your stoma and causing a little irritation there. Now, your bag, normally you'll wear the bag 3 to 5 days depending on the bag you have or what your doctor orders. This bag now has been on for 3 days and it's just over a third full, so instead of just emptying it right now, we'll go ahead and change it and get you going. Okay, so the first thing what we're going to do is, when I take the bag off, I want you to put some pressure on your skin as you're pulling the bag away from the wafer. That way it's not pulling on your skin and causing you any more irritation. Okay. Alrighty, there we go. Okay, and then we would empty the bag. This bag should be clipped. We don't have a clip. Okay. Normally it would be clipped. Alrighty, so we gotta use that again. Now what I'm going to do is remove the wafer. And when you do that, again, you're going to want to be careful as you pull it away from your skin, just so that you're not irritating the skin from the wafer. So far okay? Any questions at all? Okay, great. There we go. Okay, now the next thing I want to do is around your stoma, you're going to want to clean the area, the skin. Just make sure that it's not breaking down at all. your stoma should be red, pinkish in color. It should be moist. So if it's anything other than that, you know, if it's dark, if it looks like it's turning black or green, you're going to want to make sure and see your doctor. Okay, so the first thing now I want to do is just wash around your stoma. Okay, doing all right? Any questions yet? Okay, no. And then we'll let that dry a second, and then I'm going to take this adhesive remover, which you would use, and we'll just get the old adhesive off that's left around the stoma from the wafer. Just get it all cleaned off good. Okay, and the stoma's looking great today. Alrighty, so now what I need to do is measure your stoma. You'll have a guide like this, and depending on how, you know, what it's looking like, how it's feeling, you're going to want to measure so that you get the right fit with your wafer. That's a little big. That looks like this one. Okay. So then what we'll do is we will get a new wafer, and we'll cut it out here, okay? And you're going to want to make sure that when you're cutting your wafer, you don't cut it too big. You can always go a little bigger, but you won't be able to cut it down. You know, you won't be able to make it smaller, of course. Right, and you just don't want to be wasting supplies. Of course, they're so expensive. That's right. You'll be an old pro at this in no time. Okay, just about. Oh, you know, another thing that I haven't done, and what would be a good idea to do, and I'm just going to stop so that as I'm taking my time, but maybe you want to cover your stoma up. As you're standing, I don't know that you need to, but as you're laying here, it would be a good idea just to keep it covered so I'm not getting anything in there, and we don't want any infection, of course. Okay, just about. Okay, and then of course with your stoma, with the wafer, you're going to want to just make sure your edges are nice and smooth. You don't want anything rough against your skin. And then here we'll just make it just a tiny bit bigger, so that's going to go right around it, okay? Alrighty. Just make sure, yeah, looks like it's good. Pull our backing off here. Yeah, it's just got adhesive backing on it, so when you go to pull it off, it'll stick to your fingers a little bit. You'll just want to be a little careful. Of course, with the gloves, it's a lot worse. Okay, down, and we're gonna just get it on right over the stoma, and then you're gonna want to turn it so it's not poking you in the belly button, of course. So far, so good. Any questions at all? No? Okay. And then we'll want to make sure that there's no wrinkles. Just that it's not irritating your skin any. Just kind of press down on it. And then around on the wafer on the inside, right around your stoma. Just go around it. You can feel that, how it's kind of attaching, and see what I'm doing. Okay, great. Then what we're going to do is take a new bag, okay, and I'm going to take, we're going to have to cut this one as well, so we would just cut it out here the same size, and you were at about 1 1/8 inches there, so, and it's got measuring guides on it, so it makes it kind of easy to do. So we'll just cut this out. Careful not to cut the bag, of course. This will make things really simple for you. Yeah. Okay. Now then we'll pull the adhesive off on here. That's right. Okay. Now when you're applying your bag, of course, also, you're going to want to maybe put the bag down. You don't want it facing up, of course. We want it to drain down probably. And then this will just snap in place. So that's what we're gonna do. Snap it. You can kind of hear it snap. Okay. Alrighty, that looks good. Then what we'll do is we will clip it. This one has a self-adhesing clip on it, so just snap it and turn it under. Then I'm gonna flip it inside so it's just kind of out of the way. Alrighty. Now, do you have any questions at all? Do you think that this is something you'd be able to do once you get home? Great, good to hear, good to hear. We can, if you have any questions at all, you know, if you think of something after I leave, just be sure to call me back and I'll be happy to answer them for you. That concludes my video.